Hello and good evening, everyone. I am Nishant Sharma with my co-host Vanshika Agrawal. We welcome you all for the fourth episode of our webinar series, All Aboard for Healthy Smiles. Before we begin with today's webinar, I would like to take a moment and introduce you all to our association, the International Association of Dental Students, which was formed in 1951 to unite the dental students from all over the world and allow them to exchange knowledge and experiences about dentistry at an international level. We, the Indian Association of Dental Students, are a member of this prestigious association. We stand by our tagline, never stand still. We provide a productive, progressive, and passionate platform for dental students and young dental surgeons. Public interest is our priority. We bring webinars to upgrade ourselves even when the world is standing still in the pandemic situation. So today we have brought you a webinar on the topic Unfolding the Non-Clinical Side of Dentistry in USA. Now I would like to ask my co-host to introduce our guest speaker for today, Dr. Varun Chintakunta. Over to you, Vanshika.
Extending very good evening to the respected guest speaker, Dr. Varun Chintakunta, and all the attendees. We are really honored and privileged to have Sir sharing his immense knowledge with us today evening. Sir has completed his Bachelor of Dental Surgery from College of Dental Sciences, Davangere, Karnataka, India. He pursued his MHA, that is Master of Healthcare Administration, from Stratford University, Virginia, USA. Sir has also done a clinical fellowship in prosthodontics from Rutgers University School of Dental Medicine, New Jersey, USA. Currently, he is pursuing his degree in DMD, that is, Doctor of Dental Medicine, from Temple University, Kornberg School of Dentistry, Philadelphia, Pennsylvania, USA. Throughout his career, he has done active research, one of which was based on correlations of the severity of risk for degenerative joint diseases using CBCT. And also, Sir holds a publication in the International Journal of Clinical Research, that is on radiographic evaluation of developmental status of third molars in an Indian population. He also has an experience of working as preceptor and teaching assistant in oral maxillofacial radiology department in Rutgers University School of Dental Medicine, teaching DDS students about acquiring and reading CBCT scans and also about planning implants through the dental software. We welcome you, sir. Now, before we begin, I would like to request all the attendees to kindly mute themselves and be modest enough throughout the session. If you have any questions, you can put them in the chat box so that they can be answered at the end of the webinar. Over to you, sir.
Thank you so much, Vanishka, for introduction, and all the committee members and Nishant too, for inviting me to talk. It is my pleasure to be here and presenting the programs other than DDS or the specialty programs to you guys. So today I'm going to talk about pipeline programs. That's non-clinical side of dentistry. Pipeline programs, we have like a lot of definitions in the USA. People use it for like various purposes, but in my view, I think I'll use it as a building block to to achieve your ultimate goal. So what is your ultimate goal? That's one of my questions I ask everybody, who is coming to US. Either you want to become a dentist and work as a dentist, like get a dental license from US, or do you want to do another job other than being a dentist? A lot of people also have they don't want to be a dentist, or it might be some money constraints, or people, if people did not pass NBD, then people want to choose another career path, right? So I would say there are two routes for this one. One is just get a dental license and become a dentist, or you have another option, you can choose any other master's program. I would talk about all the master's program right now. You can choose any one of them and work as a administrator or manager or something like that. So basic thing is you need to choose your ultimate goal right now. Like you should start thinking, what do you want to do in your life? So coming to the programs I was talking about, if 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 you want to choose option one, that is to become a dentist and get a dental license, I would say choose 1 year programs. These 1 year programs are really helpful, and they give you like a lot of strength to your DDS applications or specialty applications. So personally, I did fellowship program, right? That's a clinical fellowship I did in Prosthodontics. That's in Rutgers University. So this made my application really strong. So if you have to choose anything, then you can choose one of these programs. That's fellowship. There are so many universities, there are so many schools which offer fellowship programs. There's something called preceptorship programs. Preceptorship programs are something, probably they'll be like 3 months or 1 month or even less than that. So there are a lot of universities like Boston University, NYU, which offers preceptorship programs. So even this one will be really helpful for your applications. So there's one more called observership. Like everybody knows this. You can start observing in a dental office or any other like offices or schools or anything like that. And there are research programs, there are externships. There's ACT, which is actually a UCLA program. It's a clinical program, and AGD is Advanced Education in General Dentistry. So these are all 1 year programs which will be really helpful for your DDS applications, right? And if you want to choose option two, that is what we are going to discuss, the non-clinical side. Those are the master degrees. So as I mentioned you, these programs, they give your application stronger too, but not as strong as the fellowship programs. But I would say, like in my opinion, I would say I would choose a master's degree, option. So these are the different degrees which you can get. One is Masters in Business Administration, MBA, Masters in Healthcare Administration, or there's one more Masters in Healthcare Management. There's Masters in Health Informatics. There's one more Masters in Public Health. There's Dental Public Health. There's Oral Biology Masters and Orofacial Pain Masters. So these master programs have bunch of advantages. I would go through all the advantages which are there right now. Uh, so few of the advantages here, if you choose a master's program, is first thing is you will obviously have a stronger application for if you want to apply for DDS or if you want to apply for any specialty programs or something like that. But if you do not want to become a dentist, or if you do not if you have any money constraints, or if you did not pass NBDE, so it'll be a backup option, right? So you will have something where you can have a job, have a career without being a dentist. So that is a main advantage, I would say, if you choose a master's degree. So how is it safe? Like as I told you, it would be a backup option, and you would get an F1 visa for this one. If you choose 1 year programs, I don't think so most of the universities are willing to give F1 visa right now. But if you choose masters, definitely you get a student visa for it. And nowadays, due to the political situation and Trump and all, I think it is better to have a stronger application for student visa. And the second thing is you obviously get a master's degree after you do a couple of years of the program. And then eventually you'll get a work permit. That is called OPT. What we call in USA is OPT, which you get it for 1 year. And if you're doing any program other than MBA or MHA, you will get 2 more years of extended OPT. So that means you get like 3 years of work permit if you do a master's program. If you do MBA or MHA, you get 1 year of work permit. So that is advantages, right? So you have master's degree, you have work permit, and you have a job, and then you can still apply for your like GDS or specialty applications. You get enough time to pass NBDE, you get enough time to do masters. So these are the few of the advantages I would say if you know opt choosing the master's degree. And and also I've seen a lot of colleagues, a lot of my colleagues who have great career and who are leading a good life with some of these non-dental jobs. Okay, coming to the requirements. So what are the requirements which would be helpful, to get into masters? So one is GMAT GRE or no, it's GMAT or GRE. GMAT is used for MBA or MHA applications, and GRE is used for MHA and all other master's degree applications. And TOEFL, IELTS, PT are the English exams. So you need to give one of the exams and then apply for the programs. Okay, coming to GMAT versus GRE. So which exam you need to take? For if you want to do any MBA programs, then probably GMAT would be really helpful. But if you're doing any other master's program, then I would say you need to pick a GRE. So these are the two differences. That's the only difference which you have between GMAT and GRE. So if you're like planning to do masters in business administration, then definitely you need to give GMAT, because that's most of the schools, like 90 to 95% of the schools will ask for GMAT. And GRE is asked by almost all schools for any master's program. If you want to apply for MHA or if you want to apply for oral biology or anything, then definitely GRE is really helpful for that. Okay, so I can talk about some of the MBA and MHA programs right here. So MHA and MBA are not completely different, I would say, but there are some differences between these two programs. So in MHA, you concentrate mainly on health services and health administration or health finance, planning, marketing, stuff like that. But in MBA, you mostly concentrate on business aspect of, other than health industry, you can go into all other areas. So this is a flow chart which I found somewhere. You can go back and see, how it works, and according to your preferences, you can obviously figure out what you want to do, either MHA or MBA. So what are the professionals? Where do they work? So most of the like people ask me this question: if you do MHA or MBA, where can I work? So this is one place where most of the people work is hospitals. That's almost like 39% of the people who do have this degree work in hospitals or doctor offices or all this other stuff. Coming to ambulatory, coming to like where the people will be employed. So there are a lot of places again, dental offices, health systems, even insurance companies. All these people, they want to offer a job for an MHA or MBA candidate. So what are the common job titles you would get if you do any of these two programs? So you can be a facility manager, or you can be a hospital administrator, even medical records manager. There are like bunch of job opportunities, job titles you would get. So I would say it is the best option if you have MHA rather than MBA, because you have a lot of options in healthcare industry if you do MHA rather than doing an MBA. So this is the median salary where you would get for the administrators. So if it is less than 6 doctors, you would see around $86,000. And if it is a bigger practice, then you would see around $150,000. That is almost equivalent to what a dentist will earn.
No.
So is someone saying something? Okay, so I would
carry on.
Hello?
No, sir.
Yeah. So these are the things which you need to keep in mind is this this money aspect which comes when you start doing dentistry, right? So if you become a dentist, people, most of the people think that, you know, like the money would be like in dentistry but not in non-dental jobs. But I would say that is you know, rather not a good thing to say, because most of the administrators now have like really good jobs and they earn really good money. Okay, so coming to the next program which I want to talk about is Masters in Health Informatics. I don't know if many people know this master's program. It is mainly concentrated on integration of healthcare sciences, you know, computer science, information science, and all the other, you know, techie stuff. So most of the equipment which we use here in USA is a lot of it, which deals with a lot of software, which deals with a lot of, you know, computer science, right? So this is a really good opportunity now, as you know, as down the lane, like maybe 10-15 years, you would see a lot of development, a lot of technological advances. So I would say this master's program is really helpful if you have any interest in IT side. So there's one more other program, Masters in Public Health. This is really popular program which everybody wants to get in. So traditionally, MHA degree is like has four to five core disciplines. That's biostatistics, epidemiology, environmental health, health policy, and health administration, and social behavioral sciences. These are the five areas where you can do your MPH. And whatever whatever you take in, you can pick one of the core disciplines and get a master's degree in that one, or you can take all five of them and then do a master's degree as a whole. So how do you apply to MHA programs? Sorry, MPH programs. So MPH programs are usually applied in SOFAS application. So this is like a centralized application. You guys know about CAPID, which is a centralized application for DDS, DMD programs. It's a similar fashion. SOFAS application is almost similar. As you can see right here, if you open up the website, you will find exactly the same page as CAPID. You will have to type your username and password. I mean, you can create your account, and it would be the same exact pattern where you see your CAPID application. So you need to fill out your personal information, academic history, supporting information, and program materials. In personal information, it would be like your name, race, and all that stuff. Academic information, academic history is obviously your colleges attended and things like that. And supporting information, so you need to have a personal statement and recommendation of letters. And then program materials is basically which schools you are applying to. So it is exactly similar to CAPID application. If you have listened to episode 3 or episode 2, probably you might relate to that one. It is a similar pattern where you apply. So similarly, Masters in Public Health is something called Dental Public Health. This is a really good program too, but it is a different application process. So for Dental Public Health, you need to go into ADA Pass, and then you need to apply from ADA Pass applications. So as you can see right here, I clicked some screenshots how to get onto that page. So here you can see ADA Pass search engine, and then here you can see program name, program type, and state. If you type any program type, then you can obviously go into whatever program you're searching for, and see which schools you can apply to and things like that. Okay, coming to Masters in Oral Biology. So this one usually people do it in a couple of years or like 3-year programs. So this one is mainly concentrated on research, you know, faculty jobs, and then getting into a PhD program. So how do a job offering look like? It's just to have a look how a masters in oral biology person, when they come out, how do they look for jobs, and what do they have in their job responsibilities and things like that. So what do they perform in the laboratory is the main thing where you have that offering. So coming to masters in orofacial pain, so this is the main specialty program where you get dental license from. So this master's program, it's recently recognized by American Dental Association. They said it will be a 12th specialty program. So if you do a master's in orofacial pain, you would get a dental license. You would get a dental license in almost like approximately 11 to 12 states, and then you can start working as a dentist in those 11 states. So it is mainly, most of the people, they must not know what orofacial pain is, or what do they do. So here in this field, they mostly concentrate on TMJ joints or masticatory, musculoskeletal pain, everything. It's all related to pain, like all the musculoskeletal pain or neuropathic pain or headaches or even sleep apneas. They treat sleep apneas too. So this one, most of them don't know that they did get dental license through this one. So most of them know that there's two programs, that is DDS or a specialty program, which gives you a dental license. But then if you guys do masters in orofacial pain, this is like a 2-year program. So after you finish this one, you will have dental license exam called ADEX. ADEX or CDC. You don't have to know about ADEX right now, but I'm just giving out some information. That is, ADEX is like a dental licensing exam. After you clear this master's program, you will have dental licensing exam. After you give that, you will have dental license for approximately like 10 to 11 states. And coming to other programs, you have other programs called anesthesiology or oral maxillofacial radiology or dental biomaterials. All these programs are also really good programs. I've seen a lot of people joining in dental biomaterials in NYU. That program offers master's program like for 2 years, and then it will cost you around like $90,000 to $80,000 to $90,000. And other programs like oral maxillofacial radiology or anesthesiology, it's the same application process. If you go to ADA Pass website, and then if you search anesthesiology or oral maxillofacial radiology, you can find bunch of programs, and then you can start applying for them directly from there. Okay, I think that's it. We got almost everything covered in all the master's programs. I just wanted to let you guys know that there are other programs in pharmacy, and then there are other programs in various IT departments too that I didn't cover. But it's up to you guys to decide what master's programs you guys want to get in, and what's your ultimate goal, where you guys want to be in.
Thanks a lot, sir, for the informative presentation and wonderful session. And I'm sure everyone learned a lot from this. And now it's time for the most important part of the session, question answer session. So there are a few questions from the attendees I would like you to ask.
Sure. So I said all the basic information out here. I didn't go into depths of all the master's programs. I just wanted everybody to know like what master's programs are there in US, and what they'll offer you in the end. Okay, Nishant, I think we can go to the question and answers, and then see if there are any.
Okay, sir. So is there a difference between GM80 and GRE?
Okay, so you said what?
If there is a difference between GMAT and GRE.
Yes, there is a lot of difference between GMAT and GRE. So GMAT is something where it's a pretty difficult exam than GRE. GRE is only includes math and English, but GMAT includes complex problems and complex uh, uh, questions.
So is it
But
for only USA or all other countries also?
a lot of countries accept GMAT and GRE, but but I would say if you're going for MBA, use take a GMAT exam. Otherwise, it's better to take GRE.
Okay.
Oh, my
So
video
can
is
we
not.
do MBA and MHA from India and then work in USA?
Yes, you can. You can work. What is that? You MBA and MHA, right?
MBA and MHA, yes, sir.
Yes, if you do MBA, MHA anywhere, you can still work in US. Yep.
Okay. So do all MPH specialization qualify for the additional 24 months for OPT? So do
Can I?
all MPH specializations qualify for the additional 24 months of OPT?
Yes, they do. All the MPH programs, they get 1 year of OPT first, and then they have to reapply for extended OPT. That's for 2 years. So you'll get 3 years of OPT if you do an MPH program.
Okay, sir. Thank you. The next
Yeah.
question is, how can we how can we be guided about taking the administration in different school talking to? We have to be contact indirectly with the administration or with the private consultants.
So personal experience, I would say, is I went to a consultancy and got like different school options. But if you have if you have like time and effort you can put in, you can just go to Google and then search what schools are like offering the master's programs and stuff like that. But if you want something easy, then you can just go to a consultancy and get the list.
Okay. Thank you, sir. So
Yeah.
there is attendee named Gagan. After doing his PDS from India, he immigrated to Canada and he did 2 years of master's program in MA leadership in
Hmm.
healthcare. And now he's moving to US again to do DDS. What do you suggest him to do? Should he do DDS? What's your
Okay,
opinion?
since he's already done 2 years of master's program, I would say if his ultimate goal is DDS, then I would say 1 year programs would be really, really helpful for him. Join any like any fellowship programs or do any observership. I would say be on the clinical side aspect of the dentistry so that you can get into DDS immediately. If you want to do any other masters, maybe oral biology or MPH might be better. But
Thank
I
you, sir.
wouldn't recommend
So,
again doing a master's program in leadership, or MHA or MBA in specific.
thank you, sir. So what is the difference between MPH and dental health, dental public health?
Okay, so MPH and DPH, uh, these are like BDS and MDS. So so what do you do is after doing MPH, most of the schools which offer DPH programs, right? They want you to do MPH before coming to DPH. So this is like a
Okay,
master's program that is like a doctoral program.
thank you, sir. So
Yeah,
which have better scope, MPH or MHA?
that's a tough one. Uh, Personally, if people have a business acumen or if they want to, you know, have something beyond dentistry, like in business, then I would say MHA would be better. But MPH is mostly related to research or related to to dentistry. Like it'll be closer to dentistry than MHA. But I don't know. It's a difficult one. Like to choose between MHA and MPH. It's personal choice. Yeah, I would say it's personal
One
choice.
is more of administration work and one is more of dentistry work.
Yeah, one is more of research oriented stuff and one is more of administrative and management work. So it is two different routes you're going into.
So how to get a Master of Health Informatics? Informatics.
Okay, it's a same procedure like MBA and MHA. You need to search for the programs. I would say there are like bunch of programs in Virginia too. Uh, so if you do, there's one colleague who has done informatics in George Mason University. So it is the same procedure. You need to search for it and then apply for it. Its usual requirements would be GRE and TOEFL, and then start applying. That's it.
There is a question of orofacial pain. So how
Mhm.
long is the course and the process?
So the course is 2 years program. It's similar to any other master's program. You will be in the dental hospital. You'll be working with patients. You will be seeing patients too in orofacial pain, but you won't do any clinical procedures like we do like crown preps or clusters or something like that. No, you won't do any clinical stuff, but you'll still see patients for the pain. And it's almost costing you around 70 to 80,000 per annum. So it'll be around 160K if you want to do a orofacial pain.
Do we need to give NBD to masters in orofacial pain?
Yes, you need to have NBD, but few schools they don't ask for NBD, but it is better to have NBD to have a stronger application. A lot of people nowadays they are trying to get into this program because it is ADA certified. It is ADA. They said it's a 12th specialization. They recognized it. So now a lot of people are trying to apply to this program. So I would say to be on the competitive side, just have your examinations ready before you apply.
Okay. Thank you, sir. So do we have to get our GPA evaluated and dentaping for MPH?
GPA, it's not required for MPH.
Okay.
Yeah.
So what is the advantage of doing MPH or MAH along with the DDA?
Okay, so MPH and MHA along with DDS is most of the people who do MHA or MPH is to have a stronger application for DDS. But if you want to have a job or something, then that's a different case. But you're saying MPH and MHA with DDS or like after MHA and MPH going into DDS? Those are two different things, right?
So after doing MPH and MHA
Okay, after doing MPH
and
and
then doing
MHA,
DDS.
there are few advantages. Like my dean, my school dean is a MHA candidate. He has done DDS and MHA, so he's a dentist and he's a dean of the school. So you can get into faculty positions. You can get into faculty come administrative positions like that. So it is advantageous if you do MPH or MHA and then do DDS.
So there's a student attendee who want to do his master's in oral maxillofacial surgery after BDS from India. Can he directly do master's in that?
So after BDS, you can't directly jump into oral maxillofacial surgery, unfortunately. You have to do a DDS or DMD program and then get into um, the specialty. You can do other
Oh,
specialties like perio, pros, endo, pedo, but not oral maxillofacial surgery.
and sir, orofacial pain.
Orofacial pain, definitely you can directly jump into master's program.
Okay, sir.
Yeah.
So how much maximum scholarship we get through GRE, if there is any?
Uh, I don't think so. There's any scholarship programs here, but if you say MBA or MHA, there might be some programs which I'm not sure, which offer scholarships.
So how to go for fellowship and volunteer as a dental office, uh, volunteer in a dental office in USA.
Okay, volunteering as a dental office. I mean, you can, like, how to apply? Is he asking how to
Yes,
apply, or?
yes, sir.
So it's just, you just walk in to a dental office and then ask the dentist, that you want to shadow him or just you want to observe him or something like that. So many of the dentists will be like so cool. They'll be okay that you observe and things like that.
So are there any scholarships for DDS international students
No, there are no scholarship programs.
after DDS? Okay.
Let me mute
Guys,
everybody
please
first.
mute yourself. Everyone, please mute yourself.
Okay.
So what is the scope of masters in orofacial pain, and what if the person who done that came back to India? Scope of the masters in orofacial pain in India, basically.
Masters in orofacial pain in India, I have no idea how it is working in India right now. I know it is very booming right now in USA because there are not a lot of orofacial pain people right here. Personally, I have worked with one of my dentists right in New York City. So he was a orofacial pain dentist, and he dealt with TMJ pains. He dealt with beauty blocks, and then he was working on sleep apneas. He was really earning like a lot of money. So I would say it is really good if even if you do orofacial pain.
Okay, thank you, sir. So can you give us average tuition fees for clinical programs?
What's that?
Average tuition fees for clinical programs.
Average tuition fees for fellowship programs, I would say anywhere between $50,000 to $60,000. If you are on the higher side, like maybe if you want to join in NYU or something like that, it'll be $90,000 to $100,000 for 1 year
And
fellowship
for,
programs.
okay, sir. And for DDS?
For DDS, it really has like various like long scale. Uh, you can expect anywhere between 150 to almost 350,000,
Okay, sir.
yeah. So it is for 2 years, for 3 years. I'm combining everything and telling you guys.
Okay.
Yeah. I think the cheapest one would be $150,000 and the expensive side would be around 350 to $400,000. But it would be in this range.
Okay, sir. Well, after DDS, if you're interested in OMSS, oral maxillofacial surgeon,
Yeah.
how many years is the program for international dentists?
So there are two types of oromaxillofacial surgery programs. Like there's one 4-year program where you just have to clear USMLE exams and then do your 4-year residency program. But if you're doing a 6 years residency program, then you need to do USMLE exams and 2 years of MD. That would be completely like 6-year program.
Okay, sir.
Yeah.
So for financing the tuition fee and stuff, can we opt a loan or something? Is it easy
Yes.
to take a loan over there?
Yes. It is really easy to take a loan. It'll just take 10 minutes to take a loan.
Okay.
Yeah. If you have
So,
a co-signer who is a US citizen, and if she or he is having a good credit score, um, it'll be very easy. But if you don't have a co-signer who is a US citizen, then it would be a little tough. But still, you can get it.
okay, sir. So could we apply for a 6-year program post DDS in OMSS?
Yes.
Okay. So what is
But
the
you need to
fees
have,
for that?
you need to give couple of exams you need to take. I think there are 2 exams for that. You need to take those 2 exams, and then
Okay.
just go through the ADA Pass website. I told you, right? This is really good website. For every program, just go to ADEA Pass search engine, and then just type the program name, and then you can find bunch of programs listed. So you can just look what requirements they want, things like that.
So what is the best program for freshly passed BDS students in India or in USA,
Any
according to
master's
you?
programs?
Yes, sir.
I know many people take public health as their master's degree, but if people are interested in like management or administrative aspect, I would say MHA would be better rather than going for MBA. That's just my opinions. Don't base on my opinions and then take whatever. But whatever you like, like public health and MHA are the programs which I would recommend.
Thank you very much, sir. That brings us to the end of our question answer session. And now I would like to ask my co-host to start with the vote of thanks. Over to you, Vanshika.
Thank you so much, Nishan. Winding up today's session, I would like to thank all the attendees for being such a great audience and spending with us your Sunday evening. Hope it has not proved to be in vain and most of your doubts would have been cleared. We wish you very good luck for your future. A big thank you to our esteemed guest speaker, Dr. Varun Chintakunta, for sharing his auspicious knowledge with dentists and nursery dentists and taking out time from his busy schedules for us. Thank you so much, sir. You are really an inspiration. Sir,
Thank you so much, guys, for inviting me and letting me talk. I hope I gave some basic info like out there. I hope it will help everybody. Let's see. And if you guys have any questions or anything, obviously you can contact me and or IADS. All
thank you,
right.
sir.
Thank you so much, guys.
Thank you, sir. My sincere gratitude to Dr. Navneet, President of IADS India, Dr. Praveen, Vice President of IADS India, Dr. Nitin Bhagat, North Zone Head of India, for providing us with such a great platform. Also, my sincere thanks to Dr. Palak Tihara, President of IADS Delhi NCR, and Sachin, the organizing chairperson, for being a part of the team and guiding us throughout. I would request Sachin to say a few words. Over to you, Sachin.
Maybe Sachin is not there.
Okay, I think Sachin is not there. So, last but not the least, appreciation to the entire team of IADS Delhi NCR for making this
Thank
event.
you, Vanshika. First of all, I would like to thank our guest speaker, Dr. Varun, for such amazing presentation.
Thank you. Thank you.
Am I audible?
Yeah.
Yes, now you are.
Sorry, sir, for my inconvenience.
Sachin, your voice is breaking.
First of all, I would like to thank our guest speaker, Dr. Varun, for such amazing presentation
We're not
and
able
for
to hear you,
taking
Sachin.
out time and help us all abroad series for us. And I would like to thank the IADS faculties for providing us the platform for doing the webinar. Last
Sir, I would like to take over. I believe his net is not working. So I
Yeah.
believe that's what he wanted to say. He wanted to thank the entire team for
Yeah.
helping. And every in the core team has worked a lot of efforts and put in a lot of efforts for the event to make it successful. And of course, the participants who supported us and joined us today.
Yep.
Thank you, Varun sir, for accepting the thing and coming here and helping today.
Thank you so much. Thank you guys for,
And
you
of
know,
course, the
you guys are the
moderators.
best.
Thank you
Yeah.
for
If you
conducting
have
the
any
session so
doubt,
smoothly.
Thank you, ma'am. Thank you, Sachin sir. Last but not the least, appreciation to the entire team of IADS Delhi NCR for making this event a great success. We hope to see you in the upcoming webinar of our webinar series, All Aboard for Healthy Smiles. So stay tuned. Till then, stay safe and good night.